We're glad you're here. Thanks, Claire. We're glad you're here, and we're going to begin with words of prayers. It's from our book of Common Prayer, prayer number 58. I love that we number our prayers. You can find it if you might want to use it again. So the Lord be with you.
Also with you.
Let us pray. O God, by whom we are guided in judgment and light rises up in darkness, grant us, in all our doubts and uncertainties, the grace to ask what you would have us to do, that the spirit of wisdom may save us from all false choices, and that in your light we may see light, and in your path we may not stumble, through Jesus Christ our Lord. Amen. Again, I want to say welcome this wonderful 12th Sunday of after Pentecost. And today, as you all heard in the service and found through the website, we'll be talking about the COVID-19 Delta variant. And I may have actually already mistitled it, but this is the gift that we have today, is that Don Zorn is here to help sort of unravel some of the confusion, to share some of the unknowns about this variant and what we can do best in our community to stay safe and help others be safe and healthy in this space. Dr. Donald Zorn, of course, as you know, is a member of the parish. He's also a member of our COVID-19 task force, which I guess might need a new name, COVID times task force, as we as a parish navigate these times. We are so grateful, Dr. Don Zorn and Laura Brock and all those on the task force that meet once a month and more frequently as this virus continues to affect our larger community. So without further ado, Don, thank you for being here today.
Thank you, Mother Abby, and good morning, everyone. I wish I could see you all face to face. Today, we're going to share a little bit about COVID and our knowledge, and certainly my knowledge is incomplete. Things are moving fast as they always have been, and I want to put a shout out there to my good friend and partner, Laura Brock, who does her very best to try to keep me up to date. It's a losing battle, but Laura, thank you so much. I want to also mention Skip Foster's wonderful forum he did with the TMH physicians Friday before last. There's a link in the e-chimes to that. I think maybe many of you have seen that. If you have not, I would recommend that you go to that because it's truly excellent. It's had already about 5,000 views, and I'm told that at least 1,000 of those are from people somewhat that are other than Skip. I'm sorry about that, Skip. Truly a great show, though, and I recommend that you go to that. There's a lot of good knowledge there from people who truly are experts. We are all tired of COVID. I hear that from doctors, healthcare workers. We're all just tired of it. And we're here in another surge. The numbers are going up, and locally, our numbers, as you know, are the highest they've ever been. Our hospitals are stressed. Hospitalizations are the highest they have been at both hospitals. And deaths are rising. A couple of days this week, we've had more than 1,000 deaths again nationwide, and that's going to continue. It's a different surge. This is very much the pandemic of the unvaccinated. But what we all should realize is that with so much virus out there, that the vaccinated are not totally safe either. So I looked on TMH's website today, and 95 COVID patients in the hospital, 11 of those are vaccinated. And they've been running about 10% of their inpatients are vaccinated people. That's the bad news. The good news is that the vaccinated people are doing much better than the unvaccinated. They're not as sick and they're not dying like the unvaccinated people are doing. Almost all of the people who are dying nationwide are unvaccinated. More than 99% are. The ones dying are younger and they're healthier, 20s, 30s, 40s, 50s, with no pre-existent conditions. Healthy one day, sick, and within a week or 10 days or longer sometimes, they're gone. More children are getting sicker. And that's, now, as you know, a particular concern now that the school has started back. This is a Delta surge. More than 95% of cases are thought to be caused by the Delta variant. The Delta variant started in India. It migrated over to the UK and has come to us. Simultaneous with us, it's hitting Iran, which has its highest number of cases right now, too, in crisis mode. The Delta tends to hit quickly, intensely, with devastating consequences, and then almost as quickly as it came, it recedes. As it did in India and the UK, two very different environments, two very different levels of vaccinations. And for unknown reasons, the cases drop precipitously at some point. And we hope and pray that and I have some expectation that that may happen in the US and in our community as well. But for now, cases are rising. They probably are going to get worse. Hospitalizations and deaths will follow. Why Delta? Well, the Delta does not, the COVID virus does not get in a committee room somewhere and work on ways to be more infectious. What happens by accident is there's a mutation that allows one virus to be more infectious. And Delta is that in spades. And the reason seems to be that each person infected has way more virus particles than the original COVID virus had. So, and it may be as many as 10-fold, 100-fold. So if you are around someone who has the virus, and this person could be vaccinated and have the virus, that's what we've determined is the case in the last few weeks, that person may have many times more virus than you would have faced in the last surge. So that's why there seems to be this great propensity for spread, being as contagious as chickenpox, which is highly contagious and can be spread by vaccinated people. And that's one of the reasons, one of the things that went into the thinking of the COVID-19 task force for our recent change. So what is the answer to our current situation? Well, number one, vaccines. Numbers 2 through 5, vaccines. So if you are not vaccinated, I encourage you to do so. Encourage your loved ones and those you know to get vaccinated. It will save your life. It may save theirs. It has saved many lives, vaccination. That's our main answer. That's how we're going to get out of this. But that's going to take some time. but encourage, those you love, your neighbors. I'm not saying go out and evangelize and grab someone by the collar and ask if you're vaccinated. But if it comes up about vaccination, please lovingly encourage that person for their sake and the sake of their loved ones to get vaccinated. What else can we do? Well, masking, I think, is a good thing to do, and use a high quality mask. And use it in indoor spaces where you are around people that you don't know, people that are not family members or people that you normally congregate with. Keep your distance, and that includes outside. So if you're talking to someone outside, please keep your distance. Choose wisely what you do. So if possible, choose those activities that are outdoors where you can spread out. So why are we doing things differently now at St. John's? And let me just say, there's no cookbook for this. There's no book of answers that we go to. We're just a group of people like you who meet together and try to do the best we can. The reasons is that it's just very dangerous out there right now. It's the most dangerous it's been in Leon County. Yes, many of us are protected by the vaccines, but realize that that's not 100%. The vaccines are great. They're safe. They're highly effective. They're working better than we ever expected. They were never 100%, 88% to 95%. That was the range of their effectiveness. Not at preventing infections, but at preventing hospitalizations, severe illness, and death. And for that, they're doing a wonderful job. The unvaccinated among us are sick and are dying. The vaccinated among us, some of them are getting sick and being hospitalized. The vaccinated ones among us can spread the virus. And that could be because you may be an asymptomatic carrier, or you may actually get sick tomorrow. But today you're infectious. And for the 3 days before you get sick, you've been infectious. So we're asking people who come to church to please wear your mask. And that includes coming to the church office, to the cafe. We're cutting down on the numbers because we know that the more people that are in an enclosed space, the higher the risk of spread. We're cutting back on the numbers of singers in the choir, and we've stopped congregational singing because we know that shouting and singing really mobilizes the virus in droplets and in aerosol form. And some of us singing may not have good fitting masks. And so for now, and we hope it's a brief time until we're in a better place, we have these things that we're doing. And I realize it may not be perfect. It's the best that we could come up with. And I pray your understanding and your patience until we can get to that better place. I think that by early fall, we should be better. And we get there again by more of us getting vaccinated. behind the state and behind nationally with vaccinations in Leon County. So encourage the people you know who are wondering about the vaccines. Is it safe? For me, yes. There are very few people who cannot take the vaccine. Pregnant women should be taking the vaccine, absolutely should be taking it. There are cases of very sick pregnant women who deliver early and are quite sick. So encourage the people you know who are pregnant to get the vaccine. And in the meantime, let's be careful with what we do. Now, this week in the news has been the third vaccine dose, which is now indicated and can be gotten by those who are immunocompromised. So talk to your doctor if you think you're one of those, because those should be available. It's nothing different. It's the same vaccine you got before, just a third dose. And it's thought that those who have weak immune systems, these are people who were born that way or acquired an immune deficiency or taking immune suppressing drugs, such as corticosteroids or other things for any number of conditions, including rheumatoid arthritis, organ transplantation, those sorts of things. That's about 2 to 3% of all Americans. Those people should get a third dose. Not the rest of us yet. We think that might come as early as October for those who are older and who have other chronic conditions and those in nursing homes, and working our way back down the age spectrum like we did before. Now, in the future, there may be new vaccines developed that will be more targeted to some of the variants that we're getting. But for now, the mRNA vaccines, the Moderna and the Pfizer vaccines, seem to be very effective against the Delta variant. They are not perfect. And the reason you're getting these infections, some have labeled them breakthrough. Some people don't like that term, but quite honestly, the virus is overwhelming whatever level of immunity you have from your previous infection or your previous vaccination, because there's just so much virus that's coming to you when you're exposed, more than you ever had before. And it's a certain level of virus particles hitting you that causes you to be infected and get sick. So the other thing I will mention is that if you do get infected and if you have a risk factor, one risk factor of having severe illness, there are treatments out there, the monoclonal antibody treatments, and a lot of work has been done through TMH, and I'm pretty sure through Capital Regional, to provide infusion centers where you can get these effective drugs. They're essentially antibodies targeted toward the virus that are given IV through an infusion. Currently, all the TMH vaccine infusion sites for this particular treatment are filled, but a new treatment location has been opened up at the old TOC building, Tallahassee Orthopedic Clinic building. So if you know someone who's sick with COVID and they have a risk factor, that's an option. If you happen to get sick and have a risk factor for severe disease, and there are any number of those. If you have any questions about that, just feel free to contact me at any time. And we'll see if we can't direct you to where you need to go. Make use of your own physician. And let me say, all the physicians' primary care are slammed right now. What's getting them? Well, every encounter has, as my son told me, anywhere from 2 to 7 minutes of extra discussion, no matter what you're there for, about COVID. They're wondering what to do about a family member or a friend or their own self about COVID. Also, your doctor's offices are getting hit by COVID. Nurses are sick. Other staff members are sick. Family members are sick. So a lot of your doctors are working with minimal staff, almost no staff in some cases. And so if your calls are not getting answered promptly, or if you're not able to get in promptly, a lot of them are just having to go to urgent care only for now, and neglecting some of the other health maintenance items that need to be addressed. Those will have to be delayed because things are really, really bad right now. So I pray your patience, and I understand the frustrations that you may have about that. I do believe we will be better by early fall. And I can't say enough for the vaccines. They're amazing. They are life-saving. And I don't even want to know where we would be without them. So encourage those you know. Love yourself. Love your neighbor too. Get the vaccine. So I'll stop there and see if what questions you may have.
Thank you, Don. I have one in the chat. Please put your questions in the chat. We'd love for you to type them in so we could get to them. You can send them straight to me or just put them to everyone. And I'll try to combine or summarize and read them up so everybody's there. So thank you for that. The first is, hey, Dr. Zorn, should my booster shot be the same brand that I got back in the earlier phases when that first vaccine and second doses were given?
Yes. If at all possible, try to get the Moderna if you had Moderna before, or the Pfizer if you had Pfizer before. There are some who think that they may end up being interchangeable, and there may be some places in the world where they're doing that, where they have a vaccine shortage. But here we don't have that. You should be able to get the vaccine you had before. Now with Johnson & Johnson, if you're in that minority of cases that got that one, we don't know yet. They've not approved a second, as you know, that's a single shot. They've not approved a second dose of that one yet. So it's just for those who've had the mRNA, Moderna and Pfizer. Try to get the one you had before.
So if you're a Pfizer girl like I am, you get Pfizer again, Moderna men, etc. All right. So I did hear you talk about masks and that we really need to be not wearing our cute, smart, and friendly ones that had patterns, but not necessarily thickness. Looking for thicker masks, specifically N95s, or just sturdier masks than the cute ones that we might have been wearing in the in-between.
You know, for a while I went to a cloth mask, and I used the surgical, the square blue ones for a while. Lately, I've gone back to the N95s just because I just think there's more virus out there. And so I would try to get a high quality mask if you can. If you have a cloth mask, I would double mask. Even if you have one of those, the blue surgical mask, I think I would double mask for now. And I'm talking about for the next month, 6 weeks or so, till we see how things go.
Absolutely. The sticky virus contaminants and the plethora of the contaminants. Those are the high factors that are different.
Yes. And, I see a lot of loose fitting masks out there and people still below the nose. Please make sure you cover the nose. Pinch the area above your nose.
Sorry. My computer.
Try to get the tightest fit that you can.
Awesome. Thank you. Should people with epilepsy have the vaccine?
Yes,
Yes.
probably even more so than
Okay.
the rest of us.
Thank you.
Mhm.
So any thoughts about when those under the age of 12 are going to be able to get vaccinated? What do you know about the timeline for those under 12?
The best I've heard is later this calendar year. So hopefully by December.
Mhm.
As you may know, the FDA has asked the vaccine makers to expand their trials. That is to just add a level of safety to their studies, or just to try to determine how safe these are for the kids. But boy, that'll be a game changer, I think. Um, the 12 through 16-year-olds, encourage anyone listening who has someone in that age group
Mhm.
to get their kids vaccinated. I think in Leon County, about 55% of that age group have been vaccinated. That's better than we have done generally. So kudos there. And in Leon County, we've done very well with older folks. So for 65 and older, we're above 90% vaccinated. That's why those people are not sick as much in the hospital or dying as much. Now, if you're vaccinated and are immune compromised, we're thinking about 40% of the people hospitalized nationwide of the vaccinated, 40% of those are vaccinated are those with immune deficiencies.
Thank you. So I have a mask I like to wear lots and lots and lots, so on behalf of a friend. How often can I wear my mask? Like, I have an N95? Do I wash? How often can I wear my mask? Should I be replacing it? Help me with this one.
Yes, you should be replacing it. I must say, I'm not the best at that. The cloth one certainly should be washed every few days. But the N95 I have probably should be replaced every few times that you use it. So I've been able to get a box of them and then just have several around, rotate them. And then I throw them away when they just are beyond my tolerance.
I was going to say, sometimes if you eat spaghetti and it's high full of garlic, it changes your mask. We'll be honest. All right. Moving right along. The CDC recommends no quarantine for vaccinated people who have exposure to COVID positive people. Is the Delta virus variant, that's why I got virus variant different? So again, CDC recommends no quarantine for vaccinated people who have exposure to COVID positive.
Now, here's where I would like to be looking at in Laura Brock's face, wise.
She is the one who might have asked this question.
So I think the CDC had said way back when that vaccinated people don't need to quarantine or if they're exposed. They're backtracking on that a little bit. I think they're requesting if you've had an exposure, and if you've had an exposure in recent, like in the last month or so, it will be to the Delta variant. If you've had an exposure, that you should really go ahead and get tested within a few days and probably wear a mask for sure until you get the result of that test. If that one's negative, I think you're free to go.
Awesome. I will share, and I don't think I'm breaking HIPAA laws, but we have our nursery workers are vaccinated, double vaccinated, along with your staff is double vaccinated, and they are wearing their masks around campus. All are, just as an FYI.
And our choir members were vaccinated.
And our choir members are
Wear
too,
their masks as well.
and they're wearing highly specialized singing masks, no less. So thank you for that. And I just want to make that clarification. Here's a question. Does my vaccinated 95-year-old mother need to wear a mask around her vaccinated caregiver? What are your thoughts about that?
Vaccinated 95-year-old mother need to wear a mask around her vaccinated caregiver. No. Unless there's been a recent concern that one of those was exposed or is showing symptoms or has been tested. So if you've been tested, you really should wear a mask until you know. Yeah.
Thank you, Shannon, for your HIPAA sensitivity and awareness for me. I appreciate that. There have been several questions done about that. I didn't break HIPAA by sharing that information about vaccination statuses of all those here serving others. There have been several questions to me sort of directly and you've sort of shared this. We have families that are divided on vaccinations, and your message has been quite clear. Vaccinations are the best way to prevent the virus from being contracted and potentially shared, though we know you can share it still. Any thoughts about how, with those who are still stand in opposition to the vaccine, any thoughts about how you can share that information in a loving and wonderful way of saying, I believe in it?
Well, I think the key is that you do it from the standpoint of love and concern. And so we've got enough anger out there. We don't need any more of that. Just try not to be confrontational. I think you'll get a lot farther by saying, I love you and I care for you and I'm concerned for you enough to recommend that you have a vaccine, because I think it could save you from getting sick, going in the hospital and potentially dying. That's the message. And the thing is, I worry so much about our unvaccinated brothers and sisters. They are in a world of danger right now in our community. So approach it from that standpoint.
Thank you, Don. I agree. It's out of love and care for wanting them to be here with us and be in the community. So a question about testing, the rapid test, and then also the PCR test. I did hear you say clearly, and correct me if I heard it incorrectly, when you're waiting for a test result, you really should take precautions as though you're positive until you hear otherwise. Just isolate until you know for sure you don't have that. Is there is there any recommendation to have the PCR over the rapid test, having either sort of that reliability question?
You know, there's so much virus out there. And the quick test is really quite good. It's a wonderful tool to have. But if you think you've had a serious exposure, and by all means, if you think you're symptomatic, get a PCR and get the quick test. If that's positive, that's your answer. You don't necessarily need the PCR, but a negative does not necessarily mean you're in the clear. So get a PCR I would say in most circumstances right now, just because we're in the situation we're in with so much circulating virus. I didn't mention the positivity rate, which is hovering around 14 and 15%.
Mhm.
What does that mean? Well, you want um, the percent of tests done, total tests done, to be less than 5%. That gives you um, some comfort that the virus is not circulating very much in the community. We are 3 times that. I mean, we're beyond dangerous. We're beyond high risk. We're extremely high risk. So um, I would say if you're getting tested, certainly if I get a test, I'm going to get a PCR too.
Awesome. Thank you for that. And I'm delighted to share that FAMU is still open Monday through Friday. Not sure about their weekend hours. They're still doing those tests. You drive on up, it's easy access, easily done. Now they're only giving one rather than both tests at the same time. So if you do the rapid and you test, I know they shifted about a month ago. But they still will do both. You just have to do one day and the other day. All right. So let me think. I think we have time for one more question. Essentially the guidelines are if you're out, wear your mask, and if you don't need to be out, I would say sort of keep your exposure rates low for those who are able to do that. And if you're outdoors, and distanced, your risk is less. Is that accurate, Don?
Mhm.
So the last question will be, Dr. Zorn, there's been much debate regarding the use of masks with children as they go back to school. Presently, masks are required in schools. Parents have the option to opt out, often doing this can you speak to the use of masks with children? Pretty much the same guidelines as with adults?
Nobody likes a mandate. And I think Rocky Hanna did his best to avoid it. But the circumstances were such that he had to go that route. You know, kids will wear the masks. From what I hear from people who are in the schools, that with a minimum of encouragement, the kids will wear their masks. My grandson, who just turned 2, but before he was 2, he went to the doctor, wore a mask through the whole time. He had no trouble with it at all.
Mhm.
Now, underneath the mask was a pacifier, but maybe that's what we need.
It made
But anyway, I think that the kids who have trouble with the mask are probably getting that message at home.
Mhm.
And I would just say that I do believe masks are effective in preventing the spread of the virus and protecting our children who have no protection from vaccination at this point. So I would encourage the mask to be used. The opt-out, as I understand it, that you have to get something signed by your physician in order to opt out. It's not just a
Or
thing, but
parents. Yeah, it's complicated.
mhm.
Don, I want to say thank you for being in the hot spot today and answering all of these questions. As you said, it's not perfect. The science, we continue to consult the numbers and the scientific research that's going on. And we're striving towards a healthier place, as you've said, to getting those numbers back down.
Just
Yeah.
on behalf of the task force, you know, we were very careful in the regathering plan. We did it in very, it seemed like painfully slow steps. it's really the hope of the task force that this surge will be that really tall peak, quick drop off that will allow us to ramp back up quicker than we did in the past. That's certainly my hope and prayer as we move forward.
And we are so grateful for your knowledge and your wisdom of the whole task force. As you mentioned, Skip Foster is our chair, and all of those voices that help discern the path forward. We do not remove singing without major deliberation. It was, but for those of you who did not watch the service today, if we couldn't sing, at least we could dance with our jazz music. It was marvelous, and we are grateful for everyone being a part of this process. Y'all, as a part of a community here, know that you are in our prayers, that we know each day is a challenging day to make decisions for your own family, for your own vocations. We're praying for all of you guys working in schools, who are teaching, who are going to school, who are working in the hospitals and environments where you can't stay home and work from home. And you're present in close spaces. Be brave, wear your masks, and be present with those who are fearful and anxious. For those of you who might have seen it, Mandy actually placed the link of the webinar in the chat. It's a YouTube link. If one of my colleagues who are in the chat could repost that just down at the bottom. It's a webinar that Skip Foster had with TMH with Dr. Frau. A great conversation, which sort of inspired this conversation here, talking about how the variant is so different, why it's different, and what the best steps are forward. We are thankful for your participation by Zoom. Our coffee talk will be on Zoom for the next few weeks, as we said, hoping when the numbers go back down, we'll resume our phase that we were in before, but right now we'll be by Zoom. And I want to remind you, or make sure you're aware of, for those of you who did not participate at the 8 or the 10 a.m. services, because we're socially distant, we acknowledge that not as many feel comfortable in that larger space. At 2 p.m. today and every Sunday while we're in this phase, we will have a said service of Eucharist. The preacher for the day will do that service in the church. This is to replace communion in the garden, to allow a space for those who would like to receive Eucharist still to come and receive that. So join us at 2 p.m. or join Father Wallace at 2 p.m. for that said service that will begin at 2 p.m. in the church itself. Just come on in and find your spot. The pews will still be marked as they were this morning for socially distanced seating.
And a shorter sermon.
A shorter sermon, but it was great regardless. So you can listen online, but Father Wallace will be there for prayer and for that service there. Did I leave anything out, my faithful colleagues? Again, Don Zorn, thank you so much for the gift of your wisdom and your leadership. And we are grateful to the entire task force that continues to meet and make these decisions as we as a community seek to nourish your mind, body, and spirit. Go in peace to love and serve the Lord, my friends. And Don, take a peek at the chat. There's lots of gratitude being shared with you at the end too. Thank you. Thank you, Claire.
Toodles.
Bye, Leslie. Bye, y'all.